Hi Jackie, how you doing today?
I guess okay.
Okay.
Yeah.
I understand you've had some recent difficulties that have brought you in here today.
Yeah, well, my physician, I've been seeing her, meeting with her, and she suggested I come see you, so, yeah.
All right. Why do you think she did that?
Um, well, I'm sick, I think. So we've been running some tests and things, and she couldn't find anything. So she thought maybe I should come talk to you. I guess maybe my concerns are, coming from somewhere else. I think she is what she thinks, but I don't know. Maybe whatever illness I have is making me feel this way.
So you believe you have a physical illness?
Yeah, I just know there's something not right.
All right.
Mm-hmm.
And your physician has run a series of tests to...
Mm-hmm. Yeah. We've done like blood work and all the scans and everything. And she said she didn't find anything, but I know there's something there.
So what was her, other than coming to see me, what was her suggestion for treatment? So she ran tests, she didn't find anything.
Well, yeah, she didn't have anything for me.
So she's saying there's no physical illness.
Yeah, that's what she says.
You're not as sure.
No, I think she's missing something. So.
How long have you believed that you had a physical illness?
About a year, I think, is when my first appointment with
Mm-hmm.
with my physician was. Yeah, when she started running some tests and things.
So about a year ago,
Mm-hmm.
you went to her.
Mm-hmm.
She started running tests, and there was no findings of a disorder.
No, she hasn't found anything yet.
Was it just one disorder that you thought you had, or have there been several?
You know, I kind of started with MS.
Mm-hmm.
I read some things about that and about how people my age they've had it and they don't even know that they have it, and then all of a sudden their life is changed by it. So
Mm-hmm.
I was concerned about that, and then I guess after some tests and things, it kind of, I don't know, I guess I started to think maybe it wasn't that and it was something else.
Mm-hmm.
I think it's cancer. That's what
You
I'm
think
worried
it's cancer?
about. Yeah. You know, even though I don't really have some of the symptoms, it can just lie in you and you have no idea, and it just one day,
And your physicians run tests for all of these disorders you thought you had, or you think you have?
Yeah, but I mean, what if that test that I took a year ago, what if it didn't show up on that because it hasn't gotten that severe yet, and now it is,
So you're worried.
Yeah.
So you saw the physician for the first time regarding this a year ago.
Mm-hmm.
Did you have anxiety or worry before that?
No, I'm just worried that got that feeling that I was sick, so that was just what I was worried about. But nothing other than that, no.
All right. But you were worried about the illness?
Mm-hmm.
All right. Nothing else, though?
No. Mm-mm.
Do you have any physical symptoms?
No. But that happens to people.
Mm-hmm.
They don't experience any symptoms. They have no idea. No idea. And then you're dead. You don't know.
Do you find yourself checking often to see if you have physical symptoms? Or
Yeah. I've read a lot of stuff, a lot of different people's stories.
Mm-hmm.
Go on the internet, check the symptoms, and I keep track of that. Make sure I'm not having anything that they list. So.
Are you active on the internet forums where they discuss illnesses?
Yeah. I've read a lot of people's stories on there about how they had maybe one symptom, but they didn't really think anything of it, and then they have a severe diagnosis So I'm worried I'm going to miss something, you know, so I check a lot and check to make sure.
So you read the forms out. Do you ever post?
Yeah, about my concerns, and
Mhm.
sometimes people get a little frustrated with me. They're not very nice.
Tell me about that.
Just because I'm not really experiencing anything,
Mm-hmm.
they think that I don't have anything to worry about, and they keep telling me, but I think I do have something to worry about. I just have this feeling that there's something wrong. I just know it.
What would you like us to do here at the agency?
I would just like to feel comfortable that I'm not sick. You know, I don't want to worry anymore, but I just really think I am. There's something wrong. So.
Yeah, you're worried you have a physical health disorder. You're worried that you have a mental health disorder?
Maybe. Some people have said that.
Are you worried about that?
It's a little concern that I might be feeling a little extra worried. Maybe that's a symptom of the whatever illness I have at this one.
So you're concerned that the worry could be a symptom of a physical illness?
Mm-hmm. Yeah.
So again, what would your goal be here? What do you want to change through counseling?
I guess my worry, it doesn't make me feel good.
You want to worry less?
Yeah. I don't want to be sick. I don't want to be mentally ill either.
All right. So you've had worry for at least a year,
Mm-hmm.
Specifically about being physically ill.
Mm-hmm.
There have been no findings of physical illness, but you're still worried about it.
Mm-hmm.
And you might be a little worried that you have a mental health disorder.
Yeah, I think something might be off. Yeah, something might be going on.
And you want to be able to stop worrying about the physical health disorders.
Mm-hmm. Yeah.
All right. Are you worried right now that you have a physical health disorder?
Yeah. Mm-hmm.
You know, what disorder do you think you might have now?
Cancer, I think. It's just some part of my body that is worried that it's spreading.
And you've been tested for this by your physician?
Yeah, but you know, sometimes tests don't find things, so.
Are you ever reassured when you get negative test results back, when they say that there's nothing going on?
No, I think they might have missed something. You know, and my doctor, or my family physician, she's really frustrated with me because she won't even see me anymore, honestly. She's not very nice when I go in. But I want her to do those tests again.
You wanted to rerun tests?
Yeah.
And look again?
Mm-hmm.
All right. So, you're open to counseling here?
Yeah, I think maybe you can help me a little bit and find out what's wrong and what's going on. So.
Would you be okay signing a release so that I could talk to your physician?
Yeah, that's
You're
fine.
okay with that?
Mm-hmm.
All right. So I'll get you scheduled. Now I'll schedule you either way, whether you want to sign a release or not.
Okay.
But that's just something I think might be helpful for me to better understand what's going on.
Okay.
But I'll get you in to see a counselor. It'll just take a couple days. We'll get that worked out now.
Okay, great.
All right?
Thank you.
Thanks.